Imagine trying to solve a public health crisis like a diabetes surge without knowing how many people are actually affected. Data is our secret weapon for making smart decisions.
That's what fascinates me about today's topic. I'm excited to dig into how nurses and public health teams actually gather the numbers that shape policy and save lives.
Totally! We're breaking down the essential tools and methods for collecting public health data, especially the key metrics nurses use every day.
We'll unpack what prevalence and incidence really mean, explore hands-on tools like surveys and community assessments, look at interpreting and visualizing data, and see how nurses turn numbers into action plans.
Let's start with two words that get tossed around a lot: prevalence and incidence. They sound similar, but they're pretty different in practice.
Prevalence is all about who has a disease or condition at a specific moment, like taking a snapshot. If 10 out of 100 people in a town have diabetes today, that's 10% prevalence.
Incidence, on the other hand, zooms in on fresh cases. If 5 people are newly diagnosed over a year in that same group, the incidence is 5%. It's like tracking the flow of new cases, not the total pool.
Exactly. And understanding both helps public health teams spot where problems are steady versus where they're spreading. That distinction can totally change how interventions are planned.
Switching gears to the tools, surveys and questionnaires are honestly the backbone for collecting public health data. They reach right into communities for real stories.
I love how something like the behavioral risk factor surveillance system works. It's huge. Gathering info from every state means even small towns get represented in the data.
And questions can cover everything from diet to exercise to health screenings. The data isn't just numbers. It highlights behaviors, risks, and where education or resources are needed most.
But numbers aren't just collected through surveys. Health records and databases are gold mines for ongoing data, especially for tracking trends over time.
What's cool is that these records, like genotyping results, help track infectious disease outbreaks in real time. And then there's minimum data sets, making sure researchers collect consistent info across studies.
That consistency is so important. Imagine trying to compare apples to oranges minimum data sets. Keep everyone speaking the same language, which is key for reliable research.
Community health assessments are where it all comes together. Nurses go beyond the hospital walls collecting, analyzing, and sharing data to identify what their communities really need.
And it's not just collecting numbers. Nurses help interpret those results, prioritize problems, and even present findings to stakeholders using charts, graphs, or maps. Visualization really makes the data come alive for decision makers.
Plus, engaging the community means solutions are more likely to stick. People see their own needs reflected and are more invested in the outcome.
Let's wrap up with what matters most. First, understanding prevalence and incidence helps nurses spot patterns and target interventions.
Second, using a mix of tools, surveys, records, community assessments means more accurate and meaningful data collection.
Third, clear data visualization and community engagement transform raw numbers into real-world improvements.
So, if you're a nurse or public health professional, your next step is to get hands-on. Practice interpreting some prevalence and incidence data, or try building a simple chart from a local survey. You'll be surprised how powerful that can be.